So if it doesn't and I look dumb, that'll be weird.
I press record. So is it recording there?
Yeah.
All right, well, this is our
Welcome.
presentation. Yes, welcome. This is our presentation for an inside scoop of the case study regarding ADHD. My name is Valerie.
I'm Delilah.
I'm Jocelyn.
And so for the first slide, we will talk about who Bella is. Bella is 4 years old. She's a female and she is Cuban. Her preferences is mainly Moana, bugs, nature. She loves carrots with ranch or hummus. So for the school placement, her school was actually, her current school is actually La Mariposa Elementary. Her current medical background would be that she was born a premature baby and she has a small head circumference, which also kind of indicates that she is categorized under ADHD. Her development is on track so far, and her education history is Loyal Mount Pre-K and Eucalyptus Preschool. So for our second slide, this is all about Bella's disability. Our case introduction for Bella is that she is a young preschooler who is dealing with trouble following through directions or instructions, basically. She lacks eye contact when being talked to and has difficulty sustaining attention. Bella also stumbles with simple word problems and word phrases that makes it hard for her to not only retain information during day-to-day activities, but it makes her memory kind of very forgetful in daily activities as well and cannot stay on task. And due to this, she also kind of is a very squirmy child within a school setting. And also her motor delay is due to a lack of verbal communication and expression, which means that sometimes like she'll think so much where she won't be able to verbally express herself. And these are just some of the most recent factors that Bella has displayed, which categorizes her under ADHD. These are the big three main characteristics, main categories within the ADHD condition that basically tell you that inattention is being disorganized and lacks focus, and the child has a hard time paying attention to details and has a tendency to make careless mistakes. Their work may be messy and it might seem careless, but it's basically just because they have trouble staying on task, and while talking to others, this may also be a problem because they won't be paying that much attention. As opposed to hyperactivity, it may vary with age, and you might be able to notice it with preschoolers. ADHD has symptoms nearly before, for ADHD, the symptoms usually come before middle school, and usually for hyperactivity, it'll be fidgeting and squirming when they're seated. They get up frequently to walk or run around, and they run or climb a lot when it's not appropriate. So they're always like very active. And then for impulsivity, they're very impatient, so they have a hard time when waiting to talk or react. They frequently interrupt others, and this happens because it just basically causes a lot of problems within a social setting. And sometimes friends in their social circle, their friends may also get mad at them because they're not actually paying attention to the conversations and so on.
Now in our text, we learned that instances of ADHD rose dramatically between 1998 and 2009 for the school-age children between 6.9 and 9%. And that was given from our text. But we also researched, and the CDC reports that in 2016, 6.1 million children ages 2 through 17 lived in the US have been diagnosed with attention deficit hyperactive disorder, ADHD. And research has also found that children in rural areas that are more likely to have been diagnosed with ADHD are less likely to receive behavioral treatment. And that is a lot to say, because we do see that wealthier families do get the medication treatment, behavioral treatment, whatever it is for their children. Whereas in rural areas, where poor areas, they're not as frequently seen. And that's something where we need to get that access. We need to get that to all children. We need to be accessible to all children with ADHD, so we are all aware of it. Next slide, please. Possible causes of ADHD. Various database correlates with skewed increased instances of ADHD, including exposures to toxins such as lead in the environment. So basically, toxin exposures could have led to ADHD. Some researchers correlate. Also, a twofold and fourfold increase of instances of ADHD children in prenatal exposure to nicotine, which basically means like if you are pre-exposed to nicotine, more likely than you would have ADHD. But also, if you are postnatally, which is after birth, you do not have a developed increase exposure of like developing ADHD. Other theories include ranging effects of certain sugar sensitivities on certain diets. Other early childhood environmental factors have been found to be predicators of ADHD: old mothers, low maternal education attainment, cluster instances within families, and family social problems, all found within low-income households again. Also, genetics. ADHD tends to be passed down from one to another. So if you, your father has ADHD and your mother has ADHD, more likely to happen that you will have ADHD as well. Next slide, please. How to diagnose. Like I said, it could be genetics. If your mom has ADHD, your dad has ADHD, it could be that it could be passed down to you. However, it's not a given in certain thing. You must be diagnosed to have ADHD. It's not just like my dad has it, my mom has it, that means I have it. You have to be diagnosed. You have to go to your healthcare provider and use the guidelines by the American Psychiatric Association Diagnostic, the DSM-5, to help diagnose ADHD. You know, this is really important. They could categorize you under 3 big things, which is what Valerie went over, which is inattention, hyperactivity, and impulsivity. ADHD falls under these 3 categories, but also it is also seen that one child could contain all 3 of these inattentive, hyperactivity, impulsivity qualities of ADHD. But most common, a child will have one over the other. Next slide.
All right, so now we're going to be talking about Bella's development. As for impacts of ADHD, the biggest impact of this medical condition is bound to be the learning deficits that occur due to the inability to retain information. Therefore, Bella is most impacted in a school setting. And for her learning development, will it be impacted? Bella is less likely to be able to memorize and retain certain mathematical concepts as she grows older. Word problem may be a little bit harder to process. Overall, her social life may be affected over time, especially if when Bella is not actively listening to a conversation, because it may be difficult for her to stay on topic. Next slide, please. Now we're going to be talking about intervention strategies and approaches. So there's two sections. One is non-medication and one is with medication. I'll be going over the first one. For in-home parent behavioral training, that is where the parents are learning about the nature of ADHD, how to manage their child's behavior through games that engage in attention, encourage patience, increase concentration, and practitioners would observe the parent-child interactions, which provides them with feedback and guidance in order to help out the parents and the child. Now, there's a little bit more for behavior interventions. We do have a little bit of variety for it. The first one would be token economics. And that's basically more so of a program that sometimes is conducted in an institutional setting. So for an example, it would be a hospital or a classroom in which desired behavior isn't reinforced by offering tokens that can be exchanged for rewards. The second one would be behavioral contracting, which is intervention technique in which client signs an agreement to make certain behavior change within a specific time or specified time. And then lastly, you do have self-management procedures. However, at the end, it does say that alone and in combination, and that means it can be used with non-medication and medication. So the client or can do one or the other or both. And also, if you were to take a reward system for an intervention or approach, it can be different for every child, not necessarily it's going to be the same thing. You would have to go based off what the child likes in this case. And then for a medication, we have stimulant medication therapy, which is managing ADHD symptoms, which is making them a little bit shorter. That way they can proceed in their daily life. However, under the age of 6 for drug medication is very limited. It's not the exact thing. They try to go with the non-medication approach rather than the medicated approach. However, in most cases in ADHD, it's best treated with a combination of behavior therapy and medication for preschool age children from the 4 to 5 years of age. It is with behavioral therapy, particular training for parents is recommended for the first line of treatment before medication is tried. What works best can be dependent on the child and family. Good treatment plans will include close monitoring, follow-ups, and making changes if needed along the way. Next slide, please. As for Bella's approach, in this case for her ADHD, we decided to see in-home parent behavioral training would be best. More so because Bella's parents can start learning everything about ADHD and can help her through it. Some things that they can use would be games that help her engage in attention, encourage patience, and increase concentration. Also, a possibility is that the siblings can also help out and be involved with learning everything about ADHD and also helping out Bella. And the second approach would be stimulant medication therapy. As for Bella, just develops and grows older, possible medication can be prescribed to help her shorten her ADHD symptoms. Next slide, please. And these are our resources. Next slide.
Thank you guys again so much for your attention.
So we all appreciate it.